Okay, so good afternoon. We're the RISE Freshman component group, and we will be giving our presentation on the COVID-19 pandemic. You can skip the slide. I'm Paola Bones, and I will be talking about what are coronaviruses, and I say it in plural because there are many different types of coronaviruses. Starting off, I want to say that they are a family of viruses in the Nidovirales order, and they cause upper respiratory illnesses as viral pathogens in both mammals and birds. Their name actually comes from it's the Latin word for crown, corona, and this is due to their crown-like appearance, which we will be seeing in the next slide. They actually envelope positive stranded RNA, and most of the time, bats are the hosts for the largest number of coronavirus genotypes. And in order to classify them, we have a basis of classification, in which we use different types of variables, which are their genomic organization, their genomic sequences, their replication strategies, their antigenic properties in their viral proteins, and their structural characteristics, which are based on their structural proteins, which are the spike protein, the membrane protein, the envelope protein, the glycoproteins, the hemagglutinin esterase, and the nucleocapsid protein. You may skip the slide. Here we have two diagrams. I am going to be showing, the first diagram shows their classification. As I mentioned before, they belong to the order of Nidovirales, specifically in the family of Coronaviridae. And more specifically, those that affect humans are found in the Coronaviridae subfamily. And we have the alpha coronavirus, the beta coronavirus, the gamma coronavirus, and the delta coronavirus. And then in the next diagram, we can see their structure, which, as I mentioned before, you can see the crown-like appearance due to the spike glycoproteins that make up the surface. You may skip the slide. When we talk about coronavirus-related diseases, we have the common cold, which is basically an infection of the upper respiratory tract and is usually harmless if treated. And this one is not directly related to coronavirus only because it can be caused by many other viruses. We also have the severe acute respiratory syndrome, also known as SARS by the acronym. And this one began in 2002 in the Guangdong province of China. And it was transmitted from bats to civets and then to humans. And it has an approximately 9.6% of fatality rate. And it has symptoms like dry cough, shortness of breath, and fever. And then we have the Middle East Respiratory Syndrome, also known as MERS by the acronym. And this is another respiratory illness, which actually began in 2012 in Saudi Arabia and was transmitted from camels to humans and has very similar symptoms as those of SARS. But in the case of MERS, it has, I believe it was approximately 36% fatality rate. So it's a higher percentage of fatality. And of course, I want to mention that we also have the COVID-19, which we're all familiar with. And we will be my colleagues will be talking about this even further throughout the presentation, which is the 7th coronavirus to cause illness in humans. And it is thought to come from bats in animal markets at Wuhan, China, but this is still yet to be confirmed. And I will leave you guys with my team members.
Good afternoon, this is Alani Delgado. Can you hear me? So now I'm going to be explaining why COVID-19 is classified as a pandemic. To start off, according to the World Health Organization, a pandemic is the worldwide spread of a new disease. However, they were very reluctant to call this an outbreak, a pandemic, since there is no straightforward criteria for what reaches the level of a pandemic and what does not. And there is no threshold of cases or deaths that defines a pandemic. Another reason why they were so reluctant was that the last time that WHO declared a pandemic was during the Spanish flu in 2009, which was a decision that was really criticized for creating unnecessary panic. However, WHO being deeply concerned by both the alarming levels of spread and severity and by the alarming levels of inaction for prevention, on March 11th, they finally decided to declare COVID-19 as a pandemic. By then, the number of cases of COVID-19 outside of China had increased 13-fold, and there were more than 118,000 cases in 114 countries. Next, please.
Hello, can you hear me? Yes, we can hear you.
You sound a little bit far.
I sound a little bit, what?
Okay, now I can hear you.
Okay, thank you. Well, good afternoon. My name is Angelica, and I will be presenting the symptoms of disease. Now, first off, the disease can present itself after 2 or 14 days after exposure, and the first signs are fever, cough, and or shortness of breath. Now, it still be considered whether anosmia, which is the lost sense of smell, is part of the symptoms, because it can be related to other diseases and not necessarily specific to coronavirus. Now, there are other symptoms that indicate that your health is in a big risk, and these are the emergency warning signs. Trouble breathing, pain or pressure in the chest, and or bluish lips or face. Next, please. How does it spread? How long can it stay airborne and on surfaces? The main spread is from person to person, but you can also get infected by touching another contaminated surface. Now, how long does it stay airborne? It can stay airborne for up to 3 hours, even after disinfecting the air with aerosol. And how long does it stay on surfaces? It all depends on the type of surface. For copper, it can be up to 4 hours, cardboard 24 hours, plastic and stainless steel up to 72 hours. Now, if you ask about clothes or fabrics, it relates to cardboard because of its porous surfaces, meaning it's very easy to absorb particles. Now, on a cruise ship, it was found that SARS-CoV-2 RNA was in the cruise ship after 17 days after passengers disembarked. The ship wasn't cleaned, but after they took a sample, they found out it was not active, and it was just pieces of the RNA. And this means that for it to be effective, it has to be an entire intact genome. That's why we have to look at the types of surfaces to be able to determine the hours correctly. And that will be all. Next, please.
Okay, so this is Alanis again. So anyone can be infected by COVID-19. However, the way that each person reacts to the infection is different. Most people recover without needing any special treatment, but there are people who have a high risk for severe illness from COVID-19, such as people age 65 and older, people who live in a nursing home or long-term care facility, and people of all ages with severe underlying health conditions like chronic lung disease or moderate to severe asthma, serious heart conditions, people who are immunocompromised from cancer treatments, for example, and people with severe obesity or certain underlying medical conditions like diabetes, renal failure, or liver cancer. And as for people who are pregnant, the CDC does not currently know if pregnant women have a greater chance of getting sick from COVID-19. However, they should be monitored since they are known to be at risk for severe viral illnesses. Next, please.
Good afternoon. It's Adrian Gonzalez speaking. Can you guys hear me?
Yes, we can hear you.
Yes.
Yes, Adrian, we can hear you. Yeah.
Okay. So regardless of whether you are in the demographic of risk or not, you still need to take prevention to avoid the contagion of the disease. So there are certain steps that one must take to do this. For example, you need to wash your hands with soap for at least 20 seconds. If not available, you can use hand sanitizer that contains at least 60% alcohol. And you need to avoid contact with other people that might be sick and avoid touching your face with your hands. You shouldn't wear a mask, a face mask, if you don't need it. Only if you're sick should you use it. Otherwise, it's not necessary because in these situations, resources may become scarce, and these resources like face masks should be left for professionals who are in more contact with the disease. You should clean and disinfect frequently touch surfaces with diluted bleach or alcohol solutions to kill any pathogens that might be in there. You should stay at home in order to avoid contagion as well, and practice social distancing, which is something that we will talk a little bit more in depth later. You can pass the slide. So at a governmental level, here in Puerto Rico, we are governed by the laws of the US. So we're going to be mostly talking about what they're doing in the US and here in Puerto Rico. So for travel, non-US citizens from China and other countries like Italy or Spain are being detained in airports or not allowed to be able to travel to the US because of the spread of the disease in those areas being higher. The IRS has delayed the federal tax filing until July 15th. And even though there isn't any official information yet, Donald Trump had said that there will be money being given out to people in order to subsist and have necessity and cover their necessities during this situation. In education, well, what we're doing right now, we have gone to online classes in order to stay isolated and be able to continue education. In businesses, there are being given aids in an influx of money to the businesses in order for them to stay afloat and not have to close during this time because they cannot operate, some businesses cannot operate in this moment. And specifically in Puerto Rico, there is a curfew in place that used to be from 9 p.m., but now it starts at 7 p.m. Now license plates are being checked and only certain people with certain license plates numbers can move around during the day. And there is a total lockdown where any non-essential businesses have been closed. You can pass the slide. So social distancing is exactly a term coined by the CDC for the different measures that can be taken by individual citizens, communities, and companies. For citizens individually, the CDC recommends to stay a minimum of 2 meters away from others, especially those showing symptoms. Avoid any non-essential travel. So if you don't need to go to the grocery store, or if you don't need to do anything that is an emergency or is necessary at the moment, you shouldn't go out of your house. Avoid large gatherings. Try to stay within your house, within the people that live there, or if you live alone, stay in your house. And obviously washing your hands and the other methods that have been talked about earlier. For the community, workplaces are using more flexible options like online meetings and online working so that they can keep running. Big sports events and other things like music festivals have been canceled because of how many people gather for these occasions. And conferences and services that are not essential have also been closed in order to uphold the social distancing practices. You can pass this slide. So why does the CDC recommend social distancing? Well, they recommend it because pandemics can't be stopped once they start because of how these viruses spread and how contagious they are. Social distancing, because of the separation between people, does not allow the disease to spread as widely as it has, or it can stop the spread from being as big as it could be, which could be devastating. It reduces the risk of person-to-person transmission because it keeps any affected people in quarantine. Like, in other words, if someone has the disease and they stay in their house, this reduces the risk of them passing on the disease to someone else. The goal in mind with this practice is to what they call flatten the curve, which is basically lowering the number of cases that appear in every country in order to not stop, but decrease the cases in a substantial way so that the disease can be controlled easier. You can pass this slide. So at the moment, there are no real specific treatments for this disease. It is thought that the cure, in a sense, for the disease will have to be a vaccine. But for now, there are several drugs that have been proven in vitro and in vivo to be effective against this disease. First, we have remdesivir, which is an antiviral medicine that has shown in vivo and in vitro in animal models to attack the disease and not let it contain and not let it spread throughout the body. But this medicine has not been approved yet for commercial use, and it's still waiting on clinical trials. There's also nitazoxanide, nitazoxanide, which is an antibiotic for bacterial infections. This might sound backwards because we are dealing with a virus and not a bacteria, but the thing is that this medicine has shown that it can help with the body, basically gives the body a boost, the immune system a boost in order to combat the disease better. There's also lopinavir and ritonavir, which are antiviral medications that are usually used for HIV treatment, but it has shown in vivo and in animal models that it has activity against other coronaviruses like SARS or MERS, which leads to the theory that it might be able to treat coronavirus. This medicine works by affecting the replication of the virus by affecting the M-Pro protein. We have tocilizumab, which is a treatment that is usually used for rheumatoid arthritis, but it has been found that it can be used as an anti-inflammatory to treat the pneumonia caused by this disease. You can pass the slide. We have chloroquine, which treats malaria, but it has been shown in vitro that it has activity against SARS-CoV-2. It's used to treat the pneumonia that is caused by the disease, and how it works is that it inhibits the receptors used by the virus to fuse with the cells of the body. We also have hydroxychloroquine, which is used to treat rheumatoid arthritis as well, and has a mechanism very similar to chloroquine, where it affects the receptors for the fusion of the virus into the membrane. We also have azithromycin, which is another antibiotic, which works just like the one mentioned before, where it gives the immune system like a little boost in order to get rid of the disease faster. And one of the last possible treatments that have been found are a transference of plasma from people that have recovered of the COVID-19 disease, because it is thought that those people that survived might have made antibodies, which could then be transferred into other people through this transference of blood, in other words. You can pass the slide.
Good afternoon. My name is Alfredo Ortiz, and I will be next to present. Now, for potential drugs and treatments to be able to work on the COVID-19, we first need to dive into testing, which will tell us whether or not the patient is positive or negative for the results. Now, we begin with molecular testing, and molecular testing involves the identification of certain molecules and substances like proteins and nucleic acids or genetic information in our body. And in our case, the RT-PCR, which would be the real-time reverse transcription polymerase reaction, is used for the detection of our COVID-19, or also known as SARS-CoV-2 RNA, and its analysis of its replication, which will then determine whether the patient is positive or negative for the appearance of this virus. It is currently the most effective way of testing, but due to the fact that COVID-19 is part of the beta coronavirus genre, it does share genetic information with other viruses such as MERS-CoV and SARS-CoV-1. And so it's a little complicated to be able to differentiate between these viruses. Next slide, please. Now, as for retrieving the sample, we need both an upper respiratory system sample and a lower respiratory system sample. And for the upper sample, we perform what is known as the nasopharyngeal swab. As you can see to the picture on your right, we put a swab inside the patient's nose and collect a sample from the back of their throat. And as for the lower respiratory system sample, we collect a sample of sputum, or you can also call it phlegm. Now, the way that this works is that the genetic information in viruses are typically only RNA. So once we collect this viral RNA, the strands are made into complementary DNA. And complementary DNA is artificially formed DNA from the virus RNA, if that makes sense. And so once we have the complementary DNA, we separate both strands into one, and we use primers and probes. Now we use sets of 3. So it would be 3 primers and 3 probes. The reason for this being is because to make sure that we are dealing with COVID-19 and no other beta coronavirus, we target 3 different regions in our DNA strand. And for each region, we need a primer and a probe. Now, both of these are sections of DNA which find their compatible partners in our target sequences. Now, the difference between a primer and a probe would be that a primer is set on our target sequence so that the polymerase, which is an enzyme that replicates DNA, can base itself there and then begin replication. A probe, on the other hand, holds what is known as a quencher and a molecule that emits fluorescence. Now, the molecule that emits fluorescence is constantly emitting fluorescence. And what the quencher does is that it subsides that amount of fluorescence. Now, the way this works is that the probe is usually set after the primer. So once the polymerase sets itself on the primer and begins replication of our target sequences, once it gets to the probe will detach itself from the target sequence and will also detach the quencher and the fluorescent substance. And since the fluorescent substance or molecule is not beside the quencher, then it is constantly emitting fluorescent lighting, which eventually accumulates in its surroundings as we replicate the DNA strands more and more. And this specifically is what scientists use to analyze whether the patient is positive or negative for the coronavirus. Next slide, please.
Good afternoon. My name is Janet Peña. Can all of you hear me?
Yes, we can hear you.
Okay, so today I will be introducing what are
Yes.
serological assays and how they help to detect SARS-CoV-2 seroconversion in humans. First off, in immunology, seroconversion is the time period during which a specific antibody develops and becomes detectable in the blood. Serological assays help determine the seroprevalence, which is the level of a pathogen in a given population that is measured in blood serum, and this helps to define previous exposure and to identify highly reactive human donors for the convalescent serum in order to minimize the risk of the viral spread. The convalescent serum is obtained from a person who has recovered from the virus and is considered to be rich in antibodies against the infection agent of the virus. For this testing, a voluntary blood sample is needed. Individuals that primarily compose the testing are patients that have tested positive for the virus and people that are close to positive tested patients. Serology tests exist for the surveillance or investigational purposes, and they do not exist for diagnostic purposes. They are tools that are developed in a response to an outbreak such as COVID-19 in order to understand how a virus is spread and how to approach it. However, the results from antibody testing should not be used as the sole basis to diagnose or exclude SARS-CoV-2 infection or to inform the infectious status. Next slide, please. The serological enzyme-linked immunosorbent assays that are also known as ELISA are developed with a negative control samples that represent the pre-COVID-19 background immunity in the general populations, and the other samples are from COVID-19 patients. And this test works by mixing an individual's blood sample with a solution that contains proteins from the virus. If the antibodies from COVID-19 are present in the person's blood, then they will recognize and bind to these proteins, and this triggers a color change. The methodology of the procedure is the following. First off, an altered version of the spike protein on SARS-CoV-2 outer coat that is more stable for the use of the lab is developed. This protein helps the virus enter the cell, therefore is an important target in the immune reaction against the virus, because when the body runs out of antibodies, it recognizes the protein and tags the protein for the destruction of the virus. Second off, the receptor binding domain that is also known as RBD and is the short piece of the spike protein is isolated because the virus uses the RBDs to attach to all the cells in invasions. And ultimately, cell lines are used to produce large quantities of the altered spike proteins and the RBDs. The molecules provide the base of the test, in which the antibodies in a sample of blood trigger a color change when they recognize the RBDs or the spike proteins on SARS-CoV-2 protein. Next slide, please.
Good afternoon. My name is Julius.
Yes.
Can everybody hear me? Okay. So I'm going to be presenting computed tomography, or also known as chest CT scanning, as a test to diagnose COVID-19. Computed tomography is a diagnostic medical imaging test. Just like traditional X-rays, it produces multiple images or pictures of the inside of the body. One of the main benefits of CT is that its images of internal organs, bones, soft tissue, and blood vessels provide greater detail when compared with traditional X-rays, particularly so with soft tissues and blood vessels. So how it works is that several X-ray beams and electronic X-ray detectors rotate around you, measuring the amount of radiation being absorbed throughout your body. The complete scan takes about 30 seconds to a few minutes, and this large volume of data is then processed by a special computer program, which creates a two-dimensional cross-sectional images of your body. Certain CT scans require a special dye called contrast dye, which, as the name suggests, it highlights specific areas inside of the body and creates a clearer image. Some of the common uses of this procedure is to examine abnormalities found on conventional chest X-rays. Also, to help diagnose the causes of clinical signs or symptoms of the disease of the chest, such as cough and shortness of breath,
which is one of the principal symptoms of the coronavirus. This procedure could also detect and evaluate the extent of the tumors that arise in the chest or that have spread there. It could also evaluate injuries to the chest, including the heart, blood vessels, lungs, rims, and spine. Finally, CT scanning is useful when it's necessary to check if the patient has certain lung problems, whether it is pulmonary embolism, tuberculosis, or pneumonia. Next slide, please. So chest CT scanning was a test that was used as an important complement to the test previously discussed, the RT-PCR test. On the other hand, initially it was considered as a primary tool for the detection of the virus due to its high sensitivity for diagnosis of the COVID-19. However, a study regarding the role of chest CT in diagnosis and management of the virus concluded that even though CT did have a low rate of misdiagnosis that could help standardize imaging features for rapid diagnosis, it could not be used as a primary tool since it is limited for the identification of specific viruses and also distinguishing between viruses. Furthermore, the CT findings of the COVID-19 overlap with the findings of diseases caused by viruses from a different family, such as adenovirus, making this test not as reliable when compared to the rest of the tests presented by my classmates. Next slide, please.
Hi, this is Valerie, and I'll be presenting the following 5 slides. So with the results of the different tests for SARS-CoV-2, we can get the data of how it has spread throughout the world. Up until today, COVID-19 has spread to 206 countries, leaving statistics such as 1,039,166 confirmed cases, from which 21% have recovered. The death rate increased this week from 4.9% to 5.3%, and there's a 73% of active cases. This all started in December 2019 when the first cases were registered in Wuhan, China. Then, on February 11, cases started to increase exponentially, resulting in SARS-CoV-2 being declared as a pandemic a month after. On April 1, a daily increase of 80,600 was registered, and from all the data, it has been concluded that the most affected countries are USA, Italy, and Spain, holding a 46% of all the cases. From all these cases, the Chinese CDC established a proportion demonstrating that men and women are infected almost equally. However, this proportion changes in mortality, which I'll discuss further. It is important to know how the symptoms are manifest in infected people. The majority show mild symptoms, whereas a 13.8% show severe symptoms, and the minority are affected critically. You can pass the slide. So here is a map that represents how COVID-19 is currently manifesting throughout the world, showing clearly the most affected areas like United States, Italy, Spain, China, Germany, and France. And as we know, this spreading will probably continue to increase. You can pass the slide. So according to data until today, the death rate is 5.3%, which is calculated by dividing the amount of deaths and number of cases. So this shows that the majority of people are able to recover. However, this is not a reason to stop taking preventative measures. The number of deaths depends highly on the country's management and prevention towards the crisis. For example, Italy and Spain show high percentages, which is tied to the fact that they ignored the issue, which led to malfunction on their healthcare systems. On the other hand, China and Germany show lower percentages since they took strict and quick measures on the matter. Apart from taking the right measures, the mortality of the virus depends on other variables such as age, gender, men being more susceptible to die according to Chinese CDC, which presented data showing that 63.8% of male infected died versus only at 36.2% of women. And finally, health conditions. You can pass the slide. As we know from current experience, facing a pandemic like COVID-19 brings challenges that make the situation more complex. One of the main challenges has been the overload of hospitals' capacity and lack of resources. There's data that shows that even when infection rate is low, vast communities in America are not prepared to take care of all the patients. With the overload of hospitals can come the inability to protect healthcare professionals. For example, in Italy, they made up 9% of the COVID-19 cases, which can result on hospital turning into a place where the disease can spread, which is something we don't want. Another challenge has been the management of public mental health, since population can develop anxiety and overreactive behavior, and with quarantine, we know that many people could feel alone and develop depression. The problem with this is that it's very difficult to tackle mental health issues from remote platforms. Another issue that we know is that it's been really difficult to adapt education and professional labors to remote platforms, and this has bring adverse effects that such as overstressing. And another challenge has been the economic growth and decrease in economic growth and in unemployment, since many people have lost their primary source of income. And then finally, the lack of social consciousness, that when many people don't see COVID-19 as a threat, which can result in unnecessary spreading of the virus, as was the case in Italy. And here in Puerto Rico, we know that when the classes and labor were canceled, many people took this lightly and saw it as a chance to go out, so the government had to take more strict measures. So from all the challenges can come a series of lessons that can be used for future emergencies. And I think some of the main ones are that the remote resources should be prepared beforehand to prevent uncertainty and stress. And also that it is the individual's responsibility to orient themselves using trusted resources to avoid spreading chaos. And finally, that the governments and people should take preventive measures from the beginning or even before a pandemic strikes. You can pass the slide. So with the increasing cases of COVID-19, populations tends to develop stress, as I discussed before, which results in the uncontrollable spread of misleading information. Some of the most common myths are that SARS-CoV-2 was created by people, when the fact is that the origin of the virus can be traced to animals such as bats, and many of the first cases in Wuhan, China were linked to a large seafood and live animal market. As for the spreading of the virus, there's a myth that says that ordering products from China can propagate the virus, which is mistaken because research suggests that COVID-19 can only survive for up to 24 hours on cardboard and 2 to 3 days in plastic. However, we should always disinfect products no matter where they are from to prevent getting infected with the virus. But myths like this should be avoided because they have raised social stigma against this culture in a moment where we need to have solidarity. So another myth is that pets can spread COVID-19 to humans, but there's no evidence that suggests that companion animals have propagated the virus to their owners, and also that COVID-19 can only survive in specific weathers. As for medication and vaccination, many people suggest that there's already a vaccine being hidden by the government, when in reality, we know that developing a vaccine can take months or even years. And also, some French doctors suggested that ibuprofen can worsen the symptoms of COVID-19, but this was based only on observation, and there's no scientific study to prove this. So for us to believe this, we have to wait for scientific data that prove these observations. And as for prevention, there have been many myths raised on how to prevent infection, like spraying your body with alcohol or swallowing bleach, eating garlic and using saline, or modifying your diet and taking vitamin C can protect against COVID-19. However, we know for a fact that at the moment, the best ways to prevent COVID-19 are cleaning your hands, avoiding touching your face, or avoiding close contact with people. This week, who added new myths, which I found it interesting, which said that people believe that holding your breath for 10 seconds or more without coughing means you are free of SARS-CoV-2, or that alcoholic beverages protects against the virus. You can pass the slide.
So, good afternoon. My name is Mariola. Can you guys hear me?
Yes, we can
Yep.
hear you.
So, I'll be talking about with Alejandra about the history of the Spanish flu. And as we know, COVID-19 is not the first pandemic to affect humanity. For example, we have the Spanish flu in 1918, which was a big pandemic that affected humanity starting in March 1918. In March 1918, World War I was taking place, and some U.S. military soldiers started to present flu symptoms, and after a week, there were approximately 500 soldiers infected in Kansas. The first case was reported on March 11 in Fort Riley. During April and May of 1918 was known as the first wave of the pandemic. Health reports started to mention the name influenza, reporting 18 severe cases and 3 deaths in Kansas. The travel of the troops contributed to the quick spread of this infection. During the summer of 1918, it was where it officially became a pandemic. It got to Europe, China, Norway, India, and New Zealand. By the end of this summer, Puerto Rico, Caribbean islands, Philippines, Mexico, and Hawaii had reported cases. The second and biggest wave was during September and October of 1918. More than 14,000 cases and 757 deaths were reported on a camp in Boston. Nurses were being sent to military camps, which meant that there was an extreme shortage of medical professionals. Like it is happening now, cities ordered a lockdown and closed non-essential businesses. During November and December 1918, with the end of the World War I, cases began to increase because troops were traveling back home and people were celebrating. In Salt Lake City, there were 2,000 homes quarantined because they had infected family members. Also, public health programs started educating on how to properly cough, sneeze, and dispense things. Avoiding public transport was highly recommended, and also putting the work hours less. During January to April 1919 was called the third wave of this pandemic. Many deaths were reported at the beginning of the year, but the numbers began to decrease. Education programs began to offer short basic nurse courses due to the need of medical personnel. An interesting fact is that President Woodrow Wilson collapsed while negotiating the Treaty of Versailles, and it is thought that he was weak because of the flu. Finally, in summer 1919 was the end of the pandemic, and at least 1/3 of the world's population was infected by the flu, and approximately 50 million people died worldwide. You can pass the slide.
Hi, this is Alejandra. Can everyone hear me okay?
Yep.
Okay. As we can see from the timeline, this pandemic had a very big impact on our history. This is because it was the most severe pandemic in recent history. We're talking about specifically the influenza A virus known as H1N1. What was unique for this virus was the mortality rate that was between the healthy 20 to 40 age group, which most cases, as we can see from the coronavirus, it affects people with compromised immune systems or an elder age. This is due to the fact that this virus specifically resided in the lungs. provoking the immune system to send macrophages and white blood cells to the lungs. And with healthy immune systems, that became very overwhelming and caused what they referred to as cytokine storms, which was the main cause of death by that infection. Other secondary infections like pneumonia were very common at that time. And due to the time and the period and people being very focused on the war, a lot of scientists didn't have a lot of knowledge at that time as well, thinking that the disease was caused by bacteria. Add that to not having any vaccine, any antibiotics to treat any secondary infections. Control efforts worldwide were to what we're doing now, which is isolation, quarantine, and practicing good personal hygiene. Okay, you can pass the slides.
So this is Mariela again, and I'm going to talk now about the spread of the Spanish flu. This deadly virus spread quickly because, as I mentioned, World War I was taking place, so that meant a lot of movement of the troops. The European and North American press was not allowed to address the issue during wartime. That meant that people were not very aware of what's happening and of the disease. Spain was the neutral country during this time, so their press could freely speak about the topic but have very little information. The name actually came because of these circumstances, and an interesting fact is that people thought that the flu came from French. So in Spain, they started calling it the French flu. But then when they saw that the only people who were talking about it was in Spain, they started to call it the Spanish flu and saying that it was Spain's fault. The virus attacked very old and young people, as Alejandra said. Surprisingly, many of the infected were healthy young adults between the ages of 20 and 40. It is estimated that at least 50 million deaths were reported from the 500 million who got infected, and some say it could be more. As you can see in the picture, there is a map that says approximately how many people died in each country. For example, in the United States, there was approximately 675,000 deaths. In Great Britain, 228,000 deaths. In Europe, 2.64 million. In Japan, 400,000. And in India, 12 million to 17,000. The other picture describes the three waves that I mentioned before. As you can see, the second wave was the biggest wave and the one that had most impact. This was during September and October of 1918. You can pass the slide.
And as Mariela mentioned, we can see that after the second, which was the biggest wave, it kind of dissipated over the years. That led to researchers way years after that to be constantly and look for what they refer to as the lost virus. They were very intrigued by this because they saw what, it caused that 1/3 of the population got infected. And so throughout the years, in 1930, it was actually the first time that it was recognized that it was a virus and not a bacteria, as they thought when it first happened. So later on in 1957 and 1968, we saw the surge of new viruses like H2N2, H3N2. Many researchers were fascinated, and they were able to, through collaboration, finally in 2005, sequence its genome and recreate the virus in a controlled lab in the CDC. And this knowledge is very important because later in 2009, a distant relative of the Spanish flu provoked a pandemic at which 74 countries had reported more than 28,000 infections and 144 deaths. The previous research on the Spanish flu helped scientists know more about this 2009 pandemic and be able to control it and not let it create so much tragedy, such as the 1918 flu. The CDC and scientists around the world during this time where we find ourselves are wanting to highlight the importance of learning from the past and not allowing such tragedies happen again. The importance of research and the importance of funding to be able to be prepared for any future pandemics. You can pass the slide, please. Thank you so much for your attention. If there's any questions, please go ahead.